Now, this week, pardon me, marks an important milestone in the global efforts to promote the safe use of medicines. Namibia joins over 130 partner organizations around the world in celebrating the 10th anniversary of Med Safety Week campaign running from the 3rd to the 9th of November 2025. The campaign, coordinated by the Namibia Medicines Regulatory Council, is being commemorated under the theme "Everyone has a role to play in medicines safety." This year's campaign aims to raise awareness about the importance of reporting any suspected side effects, reminding us that every report counts and can help protect others. To tell us more about this campaign, we're now joined in studio by Eunice Hayter, who is a medicines information pharmacist from the Namibia Medicines Regulatory Council. A very good morning to you, Ms. Hayter, and thank you so much for joining us.
Good morning, Deborah. Thank you so much. It's a pleasure to be here.
All right. First things first, it was definitely a mouthful of what I just mentioned, but if you could perhaps just tell us what Med Safety Week is all about and perhaps, its purpose, anything that I missed out on.
Okay, thank you so much. So the Med Safety Week is an international or global campaign which aims to raise the awareness of reporting suspected medicine side effects. Yeah. So this campaign is led by the Uppsala Monitoring Center, which is an international center for drug safety monitoring, which is a center which is situated at the WHO. So it is supported by the World Health Organization, and this campaign is done as a joint effort between the UMC, which is the Uppsala Monitoring Center, together with national and national medicines regulatory authorities in various countries. And it really also just aims to encourage patients, healthcare workers and patient caregivers on the importance of reporting side effects, because it is everybody's business to do so.
Yeah. I mentioned earlier on that this year marks the 10th anniversary of this campaign. Why do you think this milestone is so important, and how would you say it has evolved over the years?
So 10 years is really a powerful milestone. It's fantastic. So I think it really it commemorates commitment to medicine safety globally, and also the evolving of the Med Safety Week over the years. We've seen it growing from social media and digital platforms only to really just collaborating with various healthcare workers in various facilities to just encourage patients on the reporting and the importance of medicine side effects. And also, when you mentioned earlier, we have over 100, or the campaign this year has over 130 organizations that are joining, and Namibia is one of them. And these organizations are represented from over 117 countries worldwide. So it really shows a more growing commitment to medicines side effects and the importance of reporting these side effects.
Let's take us to what will be happening in Namibia. What are some of the specific awareness initiatives that will be taking place here during the campaign week? It started yesterday, right?
Yes, it started yesterday. So the campaign is running from the 3rd to the 9th of November. So it's a week-long campaign. So one of the things we also always try to dismiss is that the campaign isn't only a once-off thing. It's just to amplify the message that we do every single day. Like mentioned earlier, I'm a medicines information pharmacist and safety pharmacist. So, and the Namibia Medicines Regulatory Council, our mandate is to ensure safety, efficacy, and the quality of medicines that are on the Namibian market, and this is in the public and private sector. So the Med Safety Week really is just an opportunity for us to amplify that message. And one of the things that we've been doing, obviously, is to go on to local TV stations like we are here today. Yesterday we started with a Government Information Center, which is also a platform for us to share the message, and we had a panel discussion there on the importance of medicine safety. And this panel was also compromised by a doctor, complementary and alternative medicines doctor, which was the first of its kind in a while, because sometimes when people think medicines, they just think your traditional medicines, but then we also have complementary and alternative medicines, your herbal teas, your hibiscus, your ashwagandhas, and all these things. So it's really a week where we try to amplify the message more, that if you experience this, you should report it. And we're doing it across social media. We're going to healthcare facilities to set up stalls to encourage patients to report side effects, because out of, let me say, 10 or 20 packets of medicines that you dispense, there's a very little amount of them that are reported.
Yeah. And how is Namibia doing with regards to the medicine that we have? Would you say it's very safe for each and every Namibian?
So, okay. I don't want to say too much that is not very factual, because one of the things we do have is limited data when it comes to medicines. And we all know that Namibia isn't very, we don't have many manufacturers, we only have one at the moment in the country. So meaning that the data that there is regarding the medicines that we actually bring into the country is very limited. So no medicine is 100% safe. And for us to ensure its safety, we need the reports, because if it's not reported, we won't know. So we'll take, for example, during the time of COVID, people weren't reporting the suspected side effects. It was just hearsay on the streets, but you're actually not seeing the actual data for us to be able to make informed decisions. So whether it's safe or not, no medicine is 100% safe, I think, in any country. But then I think for Namibia, the data is quite limited, because we don't have any local or much local representation of the medicines that are brought into the country.
Yeah, I'm glad you brought up, the reports, but how can Namibia use these reports just to improve medicine safety?
So how I'll give an overview of what happens when so let me say you're an end user of the medicines. I think we all use medicines from a day to day. So you experience something like a headache, which some people feel like, okay, it's probably something usual, something normal, or it's expected or whatever. But someone else will decide, okay, let me actually put in this report. And then that report comes to us, and then we use the cumulative reports for us to be able to create a generated database to say, okay, should we inform the market authorization holders, which are the manufacturers, whether they should provide an updated safety update in the package instance, the white paper that you see in your medicines. So we try and collect the data to make those informed decisions. And then we also, in some cases, have to withdraw medicines based on the data that we gather from medicines and other research work that we do with it.
Right. Yes. Unfortunately, we are running out of time, but what message would you like to share with the Namibian public this morning during Med Safety Week? And also, how can we get on board to meet you guys halfway?
So, like I said, the message is an everyday message, it's an ongoing message. So if you experience anything, whether it's a listed side effect, say that, okay, no, Panado is supposed to give me a nauseating feeling, please report it, because the more it becomes an amplified message, and we know that, okay, maybe there's a specific brand of Panado that is actually making the side effects more pronounced. Though they're expected to happen, some of them are not supposed to be as frequent or more pronounced, because remember, medicines were also not tested in our population, so how a medicine will react with you might not be the same as it would with me. So reporting the side effects is very important, because, like I said, it's everybody's business, and if it's not reported, it's not documented. And if it's not documented, it didn't happen. So thank you.
All right. Well, Ms. Hayter, thank you so much for joining us in Good Morning Namibia. All the best with the rest of the week, and hopefully we get to have you back in studio just so you can give us a sum up of how the entire week went.
Thank you so much, Deborah.
Right.
Thank you.
All right. That was Eunice Hayter, who is a medicines information and safety pharmacist, joining us this morning, talking to us about a Med Safety Week campaign that is actually taking place right now as we speak. It started on the 3rd and is expected to go until the 9th of November.